Hello everyone, and thanks for listening today. This is the RX Daily Dose. Today's episode is being recorded on Monday, February 24th, and I'm your host, Ian Parnagoni. We update this podcast every week for healthcare providers, medical professionals, and anyone who has an interest in drug updates. Don't forget to like, share, and subscribe on all your favorite podcast platforms and social media, including iTunes, Spotify, YouTube, and Instagram. All links can be found in the show notes below. We do have a couple updates this week from the FDA, and I'll also be giving updated numbers on flu season and coronavirus. First, on February 14th, the FDA approved 3 drugs for non-prescription or over-the-counter use through a process called a prescription RX to OTC switch. The first product is GSK's Voltaren Arthritis Pain, which is diclofenac sodium topical gel 1%. It's indicated for the temporary relief of arthritis pain. Voltaren Gel 1% was first approved by the FDA in 2007 as a prescription drug and was indicated for the relief of the pain of osteoarthritis of joints. Voltaren arthritis pain is not for immediate relief and may take up to 7 days to work. The second product is Alcon's Pataday Twice Daily Relief, which is olopatadine ophthalmic drops 0.1% and indicated for the temporary relief of itchy and red eyes due to pollen, ragweed, grass, animal hair, or dander. The prescription version was Patanol. And the third is a similar product, that's Alcon's Pataday Once Daily Relief, which is olopatadine ophthalmic drops 0.2%, also indicated for the temporary relief of itchy eyes due to pollen, ragweed, grass, animal hair, or dander. Pataday Twice Daily Relief was first approved by the FDA in 1996 under the name Patanol and was indicated for the treatment of the signs and symptoms of allergic conjunctivitis. Pataday, now Pataday Once Daily Relief, was first approved by the FDA in 2004 and was indicated for the treatment of ocular itching associated with allergic conjunctivitis. These drugs are mast cell stabilizers, which work by preventing the release of histamine and therefore prevent or control allergic disorders. For a drug to switch to non-prescription status, the data provided must demonstrate that the drug is safe and effective for use in self-medication as directed in proposed labeling. The manufacturer must show that consumers can understand how to use the drug safely and effectively without the supervision of a healthcare professional. All 3 products will be marketed in the United States as non-prescription drugs and will no longer be available as prescription products. The FDA also this week approved a new levonorgestrel and ethinyl estradiol transdermal system going by brand name Twirla for contraception in women whose BMI is less than 30 and for whom a combined hormonal contraceptive is appropriate. The patch is applied weekly and delivers 30 micrograms daily dose of ethinyl estradiol and 120 micrograms daily dose of levonorgestrel. As part of this approval, the FDA will require Agile Therapeutics to conduct a long-term prospective observational post-marketing study to assess the risk of venous thromboembolism and arterial thromboembolism in new users of Twirla compared to new users of other combined hormonal contraceptives. Twirla is contraindicated in women at high risk for arterial or venous thrombotic disease, including women with a BMI greater than 30, women who have headaches with focal neurologic symptoms or migraine with aura, and women older than 35 who have any migraine headache. Twirla should be avoided in women who have liver tumors, acute viral hepatitis, decompensated cirrhosis, liver disease, or undiagnosed abnormal uterine bleeding. It should also be avoided during pregnancy, in women who currently have or who have a history of breast cancer or other estrogen or progestin-sensitive cancers, in women who are hypersensitive to any component of Twirla, and in women who use certain hepatitis C drug combinations. Because cigarette smoking increases the risk of serious cardiovascular events from combined hormonal contraceptive use, Twirla is also contraindicated in women older than 35 who smoke. Per the FDA, Twirla will contain a boxed warning that will include these risks about cigarette smoking and the serious cardiovascular events associated with it. And it will stipulate that Twirla is contraindicated in women with a BMI greater than 30. Agile Therapeutics states it should be available by fourth quarter of 2020. And finally this week, the FDA approved cysteamine bitartrate, which goes by brand name Procysbi, for the treatment of nephropathic cystinosis in patients aged 1 year and older. The new formulation is delayed-release oral granules. Previously, Procysbi was only approved as delayed-release capsules. Immediate-release capsules and an ophthalmic solution is also available. Both those products go by Cystagon and Cystarin, respectively. The new packets provide an alternative treatment option for patients and caregivers. The contents of the packet can be sprinkled on certain foods such as applesauce or jelly, and juices except grapefruit juice, and administered orally or mixed with applesauce, and administered via a gastrostomy tube. Procysbi, a cysteine-depleting agent, is expected to be available in 75 mg and 300 mg single-use packets in the first half of 2020, and is currently available in 25 and 75 mg delayed-release capsules. Both the capsules and packets contain the same oral granules. And in the news from this week, an update for you on influenza and coronavirus. For the coronavirus, and these numbers are as of Sunday, February 23rd, the coronavirus death toll rose to 2,470. 2,444 of those are from China, and the number of confirmed infections rose to 78,996 worldwide. 76,942 are from China. There are 35 confirmed cases in the US and 26 deaths that are outside of China from the virus. And for influenza so far, in the US alone, the CDC now estimates that so far this season, there have been at least 29 million flu illnesses, 280,000 hospitalizations, and 16,000 deaths from the flu. 105 deaths have been reported in children. Overall, hospitalization rates remain similar to this time during recent seasons, but rates among children and young adults are higher at this time than in recent seasons. And that's all I have for this week. I hope you enjoyed today's episode. I'll include all links and resources in the show notes below, so please go back and check those out too. Please connect with me on any of your social media platforms and give me feedback on what you heard today. I'd love to know what you thought about the episode. And as always, feel free to like, share, and subscribe wherever you listen to your podcasts. And thank you so much for tuning in. I hope you enjoy the rest of your day. Music by Joseph McDade.